Assalamualaikum. Thank you to everyone who's joining us today for Zoom in on the Halal Metropolis, where we look at how the Muslim community in Southeast Michigan is dealing with the COVID-19 pandemic. Today, we're joined with a very special guest. This is my brother, Abubakir Baban. Usually, Halal Metropolis isn't really super nepotism, but today we're having a conversation with him because he is actually working on the front lines of the pandemic. And so we thought it would be a great opportunity to have a conversation with a healthcare provider who has not only dealt with taking care of patients who are dealing with COVID-19, but who himself tested positive for the disease. So Abubakir, why don't you introduce yourself, tell everyone a little about what you do and how this all came about.
Hi everyone, Assalamu alaikum. So, like she was saying, my name is Abubakir Baban. I'm an ICU nurse at one of the hospitals in Dearborn. In our particular ICU, we're designated to be the COVID unit from the beginning, which means that basically all of the COVID patients from the beginning, the sickest ones, would come to our ICU. I think just having clear guidance and having those rules set from the beginning, because what we were basically doing what they were telling us to do from the beginning, but they kept changing so fast and so often that for a second we lost a sense of trust in their guidelines, because one day they would tell you this and then tomorrow you come back to work and you see people doing things differently, and then we're wondering what's going on. And they said, oh no, these are the new CDC guidelines, or these are the new guidelines for the hospital, and this is how we are doing things now. So I think that moving forward, obviously a lack of supplies, we need to make sure that we can get that under control in case something like this happens. We don't have to reuse equipment. We don't have to do those kind of things that really puts everyone in danger. And like you mentioned, I mean, I tested positive. I had the proper equipment on, but at the same time, it's just the risk of being there with someone that has it. It'll happen.
Yeah. And can you talk a little about being tested? What was that like? I know we've seen drive-through testing. A lot of people have talked about how testing is invasive, and that it's like really painful. So do you mind just talking a little about that? Were you anxious going into getting tested? Did you already feel like you had a sense of, I already know what my test results are going to be before I even get it back?
Yeah. So basically, the first thoughts of having it was the day after my shift. So I worked on Friday. I got off Saturday morning, and then I got home. I slept like I normally would after work. I woke up Saturday, and I knew something was wrong. I didn't feel the same. And at first I brushed it off as, I worked 3 days in a row. I was probably just tired, need to relax. But by Saturday night, though, I started getting the first signs and symptoms of having the illness. So I started getting a fever and having small cough and really getting body aches. The next morning I called my primary care and I told him what's going on. And he said, okay, just stay home for now. But no one made any mention of testing or being tested in the beginning, because as I don't know if you're aware, but I'm sure you are, that not everyone was going to get tested from the beginning. That was their idea, was they're not testing everyone, only people who are really sick and need to be hospitalized. So I didn't really qualify for that in the beginning. So even then, no one mentioned it, that they were even offering it to me.
And is that because there are such a limited number of tests in the country?
Exactly. So there's a limited number of tests. They're not testing everyone. The only people they test is if initially, and I know part of it's still true, that need hospitalization, that need to be admitted, then they test them just to make sure that their treatment plan is based on the COVID-19. But I didn't get tested. And then the next day I called my physician again, and he said, okay, we'll just test you. Because I told him I was around patients who were positive, and I really think that I might have it. And then he ended up okaying the test. It took about 3 days. It's a very uncomfortable test. It's a swab that you have to put really deep back and you put it in your nostril and it go really far back, and it's a cotton tip, so it's very uncomfortable. And you send that sample in. It took about 3-4 days, and it came back. And I suppose I wasn't surprised, but it did come back positive.
I mean, I'm looking at you now. You can speak to me. You don't look like drained of energy. So, I mean, what is the variation in the symptoms for individuals who do contract COVID-19? Like, because I'm looking at you again, like I said, you look fairly healthy in front of me, but I'm assuming this is probably like 4 or 5 days out for you now. So what does it look like for other people? How varied are the symptoms? And I mean, you said you had cases where people are on ventilators. So can you talk a little about the spectrum, the variation, what that looks like, what people should be looking out for?
So I'd probably say that I on that spectrum, I'd probably be on the most mild symptoms of a patient who has it. And then the extreme other end is going to be being on a ventilator, being paralyzed, being sedated, being prone, which means you're on your belly to help you oxygenate. So that's the worst case scenario. And I really think I was fortunate enough to have the best case scenario. I think an important part of the whole disease process for this is that it starts off closer to your throat and your nose, and then it works its way down into your lungs, and then it settles in, and then you get the pneumonia from it. So what I was trying to do from the beginning, and I still try to do these exercises, is really try to inflate my lungs so that way I don't give it an opportunity, because a lot of people, when they get sick, they will just lay down and think that they need to rest so that way they can heal. But a part of the preventing the pneumonia is making sure that your lungs are really expanding, you're coughing, you're breathing in deeply, and making sure that you're really expanding your lungs so that way the pneumonia doesn't have a chance to settle. At least it can help in preventing it.
Well, that's great information for people to know. So we talked a little about the medical side of everything, but how are you coping with this mentally? I mean, you have a family, and must be hard to, because you just never know, especially with people saying that you can, once the symptoms seem like they've gone away, that they could reemerge. Like, how are you dealing with all of this mentally?
I do live with my wife and our daughter in the same house, and it's been difficult staying away from them, but also more importantly being away from work, knowing that your colleagues are going to work still, they're still there taking care of those patients. The staffing is poor right now because just how sick they are. You need more nurses.
Yeah, and especially considering that they being the ones that are treating everyone, it's like they're doing the job that no one else can do, but then also while they do that job, like what happened with you put yourself in the line of fire.
Right.
And how do you feel about the way that, just when we talk about our healthcare system in the United States, having doctors and nurses and, physician assistants and DOs, like all these medical professionals who go into debt to serve people and are now, putting themselves in, exposing themselves to this deadly disease, and at the same time having huge amounts of debt that they can't pay off, or having families, I've read reports of healthcare professionals who did die and who were like, what happens now with the debt that they had from medical school or nursing school? And do you have any thoughts on that? How do you feel about that?
Yeah, so I think that the conversation needs to be had about debt and college and paying for those kind of things, especially for services that the people are providing back services after their education, like nurses and doctors and those kind of fields. I think that the conversation needs to be had about whether that debt can be forgiven or that debt could be, decreased in some way, because it really does put a burden and strain on the individuals that do go out and work and do these tough jobs every day. Um, and especially our healthcare system. I mean, we should really, now everyone is able to go and get health care, but the problem is it prevents a lot of people from going, because if you know that you can't afford it and that you're going to get a bill that you can't afford, you're more likely to stay home, and then that's more likely to make things worse, because the time that you do show up, because you waited so long, now you require so much more care, and it's going to be so much more expensive to heal that person.
Yeah, yeah, that's a lot of stuff that has to be revamped with the way this country runs. Well, do you have any other last thoughts that you'd like to share personally? I know we talked about the mental effects and just the medical side of everything, but just personally, what's something that you are really sad that you get to miss out on because of the pandemic and everything that's happening?
I mean, I think with just everything closing, the
Yeah,
things that we took for granted, we expected them to be open every day, and now they're not. So now you really miss them, not being able to go to your community centers, to the mosque, and going to just meet with friends and those kind of things, that we really, and then looking forward to Ramadan coming up, it just makes it difficult.
yeah,
Spiritually looking forward and not seeing, that those things could possibly not happen this year. So I think that's really been tough on a lot of people that I know. And but if it means that people are going to be safe and we're save lives, then it's justified. And hopefully that we'll be able to do those activities soon.
yeah. Or in the meantime, just create a social community virtually online.
Yeah,
That's
yeah,
all that we could do.
exactly.
Okay, well, thank you so much. Thank you to everyone for joining us. And if there's anyone out there who has a story that they would like to share with us so that we can share it with the rest of the community, please let us know. Thank you so much, and we'll see you on the next one. Assalamu alaikum.
Yeah,